Assalamu alaikum to all of you. I am Umar Qureshi from Dr. Sirajul Islam Medical College and I am in the 4th year. I am the team member of the Medimartt. Medimartt is a platform for the medical students. As you all know that we are regularly trying to share some short videos on different topics. So here we come with another video. This is a short video on the basics of the heart. This is the 9th part of the basics of the heart. You can watch our previous 8 parts on our YouTube channel and on our Facebook group. Okay. So let's move towards our topic. As you all know that our reference book is Ekadatta, so we have inserted our the page of the Ekadatta. You can check it out, and this is the heart. So let's discuss. In our previous videos, we have covered till the inferior border. So today we will discuss the left border and a small part of the sternocostal surface, inshallah. So left border, the other name of the left border is the margo obtutus. Okay, then what Ekadatta is trying to say that it is an ill-defined convex border. Okay, so basically this border is called as the left border. It is an ill-defined. It is not actually defined. It is like something actually what border is? Border is something like a plain line, okay, or a sharp line. That's called as border. But in this case, in the left border, it is something like that. Okay, and it is something like that. Means we can call it as the left surface also, or we can call it as the left border also, but specifically the Ekadatta has called it the left border. Okay, so we also have to call it as the left border. So basically it is an ill-defined convex border. It is convex, okay, and it is ill-defined. Then separating the sternocostal surface from the left surface, as we all know that this surface is the sternocostal surface, okay, and there is a left surface over here. Okay, so this left border basically separates the sternocostal surface from the left surface. Okay, then it extends from the left auricle to the apex of the heart. Okay, so what this point is that basically we have to understand that in the right atrium and the right auricle, okay, there are two main parts in the right atrium and the left atrium. Okay, as this is the left atrium, so there will be a left auricle will be present. This is actually the auricle. Okay, this is the auricle. So left auricle will be present in the left atrium and the right auricle will be present in the right atrium. Okay, so what Ekadatta is trying to say that the left border extends from the left auricle, as this is the left auricle and this is left part. So it extends from the left border or the left auricle to the apex of the heart. This is the apex. So this is the left border with the convexity directed upwards, and the border is accompanied by the marginal branch of the left coronary artery. Okay, so basically convexity of this left border is a little bit upwards. You don't have to remember this point, this is not that much important, but this point, the border is accompanied by the marginal branch of the left coronary artery. You have to remember this thing. As we all know that there are two main coronary arteries, we have discussed in our previous videos, that the right coronary artery and the left coronary artery. A branch of the left coronary artery comes over here also, and a branch of the left coronary artery comes over here also. Okay, so and it distributes just like that. Okay, so as this is the left border, this one is the left border, so the left coronary artery accompanies this left border, means the marginal branch. Actually something like if we are assuming a circle and something attaching to this border is called as the margin, or this is or the outer lining of this circle is called as the margin. Okay, so that's why it is called as the marginal branch of the left coronary artery. Okay, so that's it for the left border. Then we will move towards the sternocostal surface. Now basically sternocostal surface, this is the sternocostal surface. Sternocostal surface, it is directed forwards, as we all know that it is directed forwards. Then it is slightly upwards, as I already told you that heart is something like oblique in direction. That's why the sternocostal is like directed upwards. Okay, then and separated the base by the right border. Okay, means the separated from the base by the right border, as this is the sternocostal surface. Okay, and this is the base of the heart. Okay, so this thing, the sternocostal surface, is separated by the right border. This is the right border. Okay, so it is separated by the base by the right border. This thing Ekadatta is trying to say. Then from the diaphragmatic surface by inferior border. Okay, means basically that Ekadatta is trying to say that this sternocostal surface is separated from the base, like how it is separated from the base, then how it is separated from the diaphragmatic surface. As we all know that at the posterior there is a diaphragmatic surface, and with the left surface, here is a left surface. Okay, so how it is separated from all these three parts, means with the base, with the diaphragmatic surface, and with the left surface. So this sternocostal surface, it is separated from the base by the right border. Okay, then from the diaphragmatic surface by the inferior border. As we all know that here is the inferior border, so it is separating these two. Here is the at the posterior side, here is the diaphragmatic surface, so this inferior border is separating these two. And from the left surface by the left border. Okay, as this is the left surface, then this and this is the left border, so with the left surface, with the help of the left border, it is separated. Okay, so that is the point. Now the main portion, this thing you all have to remember because it is frequently asked in the items, that this surface is formed by the following parts of the heart. Like this is the sternocostal surface, so this sternocostal surface is formed by the mainly by the four different parts. And what are they? Those are the anterior surface of the right atrium and its auricle. I just told you previously that this is the auricle. Okay, and this is the right atrium. Okay, so this basically this is the right atrium. Okay, a little portion of the right atrium and the little portion of the auricle. So it is formed by the anterior surface, and this is the anterior surface, so it is formed by the anterior surface of the right atrium. Okay, and its auricle. This is the auricle of the right atrium, so its auricle. Okay, then a part of the anterior surface of the left auricle. Here it is the left auricle. Okay, here we will not include the left atrium because here just left auricle is included. Okay, so a part of the, only a little part of the anterior surface of the left auricle is included. Okay, then anterior surface of the right ventricle. Okay, as we all know that this is the like a right ventricle and this is the left ventricle. Okay, so as this is the anterior, means the sternocostal surface is anteriorly like facing anteriorly. Okay, that's why every part will be like anterior surface, anterior part, that's a little kind of thing. Okay, so this thing, that this is the right ventricle, so anterior surface of the right ventricle means 2/3 part of the anterior surface of the right ventricle, and this will be the 1/3 part of the anterior surface of the left ventricle. Okay, it will be smaller and it will be greater in case of sternocostal surface. Okay, means sternocostal surface is formed like 2/3 portion of the right atrium is used and 1/3 portion of the left atrium is left ventricle is used. Okay, so 2/3 portion of the right ventricle is used and 1/3 portion of the left ventricle is used. So that's it like for today. If you love the video, then please do mention your friends, please do invite and share it as much as possible because it gives us motivation to make more videos like this. And thanks.